Hi, my name is Lisa. I am the founder of the Hypertrophic Cardiomyopathy Association, and 95 days ago, I received a heart transplant. But that's not what I want to talk to you about today. I want to talk to you about healthcare reform and this concept of pre-existing medical conditions and how it's going to impact those with chronic illness if not done properly. So in my past, I was a human resource manager and health plan administrator for a small company here in northern New Jersey. We were, this was the 1980s, and at that time I was experiencing quarterly increases in the range of 30% on our Blue Cross Blue Shield policy. So these rate increases are nothing new, just to bring it into perspective here. It's been going on for a long time. So we actually took the time to look at options on how we could better afford healthcare for our faculty, our staff. And we decided to go with a new method at that time. It was a little risky. It was a self-insured plan with a third-party administrator and a stop-loss policy. So we paid the claims up to a certain amount of money, then we had an insurance company override us for that. And I will tell you, I did this for 18 years, and 17 out of the 18 years, we beat the market. And we provided really great health care to our staff. So it can be done if there's not a lot of overhead involved. So number one, if we're going to start with healthcare reform and trying to get costs into some type of reality, I think we need to look at compensation. I did some quick math the other day from just one insurance company's executive, the CEO. His compensation package required 1,700 families to pay premiums. There was no health care paid for in that, just his compensation. So if 1,700 families have to pay for one human being out of one insurance company, take the rest of the senior executives within that one company and then add in all the other companies. Where are we putting our money? Into health care or into enriching a small group of people? That's item number one. Item number two, why are we still allowing our employers to choose who our health insurance companies are going to be? Do we let our employers choose who our auto insurance is or who our homeowners is through? We do not let them make those choices for us. We make those choices for ourselves. And I think that's a much better way to do this. But how can we afford to compete against big groups if we're just little individuals? The ACA tried to balance the playing field, but the insurance companies didn't like it, in part because it's too much work for them to come out and bill each individual person. They would prefer to bill one entity where there's a lot of people. I can understand that from a billing perspective. It's less work, it's less overhead. However, if they can bill us for auto insurance, if they can bill us for homeowners insurance, they can take on the expense of billing us as individuals for health insurance. Now let's talk about pre-existing conditions. I was born with a genetic disease. It's not that I'm a bad person, as one crazy elected official decided to say about people who had illness, that we weren't living a godly enough life or whatever the hell he said. I've lived a pretty good life. I've committed my life to helping other people. If you don't think that's good enough, sorry, you don't agree with my lifestyle choices. But I had a genetic disorder. I was diagnosed at 12. When I was 18, I was kicked off my parents' health care plan. I had to go immediately and get a job that had insurance because I knew I had a very serious heart condition. And it's a good thing I did, because at the age of 21, I had a stroke secondary to what's called subacute bacterial endocarditis after a dentist told me genetic heart conditions don't need to be premedicated. He was wrong. I lost part of my brain because of it from the stroke, and I'm partially blind in one eye. No fault of my own. Listening to a doctor, there's my dog, I have now the pre-existing condition of my heart. I have a pre-existing neurologic deficit. I have a pre-existing blindness in my left eye. The last two were not because of my own choices. It happened to me. As my disease progressed, I needed pacemakers, defibrillators. I needed antibiotics, IV. I needed all kinds of things until the ultimate thing I needed was a new heart at the age of 48. And I'm happy to say that I am the very proud recipient of a beautiful 31-year-old heart from a lovely donor family. These things cost money, And the good news is my husband's current employer, because that's the only place we can get insurance, is a really, really compassionate company, has great health care. So I didn't have to go bankrupt to get a heart transplant. I didn't have to go bankrupt to pay for my medicine. But there are people who will go bankrupt because their medical expenses are too high if we don't keep them under control. So this pre-existing condition thing, the way that the healthcare plan is written today, and it is May 9th, 2017, and this is subject to change, is that if you go without coverage for 64 days, when you come back into insurance, they can charge you up to 30% more. Okay, let's be real for a second. Why are these people not going to be covered for that 64 days? Because they can't afford the premiums. And I don't see any stopgap, catastrophic plans put in place to be able to help bridge them from insurance plan to insurance plan that they can afford. I just say, oh boy, we got a gap where we can drop them off, and then when we pick them up, we can gouge them for more money. These are the people that couldn't afford it to begin with, and you're going to hit them with 30% more. What does this do? It makes people sicker, and it makes people scared. It makes people stay in jobs they don't like because they're afraid to lose coverage. And it puts our employers in a let's put it this way. We become indentured servants because we can't leave in many cases if you have a pre-existing medical condition. You just can't leave. You got to stay with a job that you might not like because you don't have any other options. That's not right. That's not American. We shouldn't have to stick with the job that we don't like. You want to talk about building innovation and growing businesses? Don't make us afraid to go out and try a new venture because we won't have health insurance. Let us have the security that we deserve as human beings and as American citizens. So the point of this rant, and it is a rant, is we need to do better. We need to have health insurance guaranteed at a reasonable cost. Not looking for handouts. I've been paying insurance premiums since I'm 19 years old on my own until present day. Never had a gap in insurance. I've always found a way, even if I had to go without lots of other things, like food, like vacations. I had to pay for my house and my insurance and my car. No frills in my life. I certainly do not live like the Trumps. I do not live like the top 1%. I live like most Americans, paycheck to paycheck. And we need to do better. I shouldn't have to worry that my government is going to take away my protections and force me into bankruptcy. I'm living with a heart transplant now. I've exchanged one set of problems for another. You're not cured, and you don't just move on with your life because you have had a transplant. See these little marks on the side of my neck? I have to have catheters to check my heart with biopsies to make sure it's not failing. This lovely little scar down the middle of my chest was where they put the new heart in. If I get sick, I got to go to the hospital. I'm immunocompromised now. I have a lot of possibilities of big medical bills coming, and I will keep my insurance in place. But there are millions of people like me. We're living on the edge of a health crisis that could put us into financial ruins. Why is this important? Because even though I have group insurance, they want to take away lifetime maximums and let your insurance company say, nope, $2 million, that's all you get. After that, we don't care what happens to you. I gotta tell you, I'm pretty damn close to $2 million in medical expenses over my lifetime right now. And if we had caps, I'm going to be in a position, as are many millions of Americans, where we're going to be threatened with bankruptcy again to live. So it's live or go broke. You shouldn't have to make that decision. We're in the most amazing country in the world, but we can't figure out how to get universal health care for everybody or cost-effective health care. Now let's talk about universal versus paying premiums for health insurance. What's the difference between paying a tax and paying a premium? Not much. Same amount of money, just calling it one thing or another. So don't get all worked up if somebody says, let's move to a more socialized system or a socialized option. Keep the insurance industry as it is, but give people an option to buy into Medicare or something similar when they're under 65. It would be really, really helpful on a national basis. and this nonsense about letting states pick and choose what they want to cover, or, oh, I don't want to cover maternity. I don't want to cover children to get immunizations. I don't want to cover pre-existing conditions. Come on, people. This is ridiculous. We're better than this. So this rant that is part of my blog page is for one purpose, is to say, wake up. This is not a Republican versus Democratic issue. This is not socialists versus capitalists. This is human. This is a human issue. When Jimmy Kimmel mentioned his son being born with a heart defect and needing surgery, and Newt Gingrich popped in and said, any kid could get that coverage. All you got to do is go up in an emergency room. Let's talk about that for a minute, Newt. You couldn't be more right and more wrong. Yes, you can go to the emergency room for emergency services. I happen to have hypertrophic cardiomyopathy, or I did. And if I went to the emergency room having symptoms of shortness of breath, dizziness, chest pain, fainting, all the things I did all my life, they would treat me for the acute situation in front of them. They would stabilize me and send me home, with or without insurance. That's all they're required to do. If I went in there with my defibrillator malfunctioning, they would turn it off. But what if the battery was dead? It is not life-saving therapy to change out an implantable defibrillator. What does an implantable defibrillator do? It revives you after ventricular fibrillation, also known as sudden death, and revives you quickly before there's any brain damage. So, yes, a child can go to the emergency room, get emergency treatment, even if it's heart surgery. But who's going to care for that child afterwards? Who's going to provide the medication, the checkups, making sure that the child isn't decompensating? That doesn't happen in an emergency room. And by the way, who the hell do you think pays for the emergency room visits? Let's go back to the way it was. There was a surcharge on every bill to pay for indigent care. So we were all paying for it anyway. But politicians don't want you to see that. They want to make it look like it's this big evil empire that the government's doing something wrong to you. No, they're not. The ACA, albeit flawed, was a starting point. When Medicare was passed, it was flawed. We've worked to improve it over the years. And let's go back to the mid-60s and before. It was illegal to make a profit off of insurance companies, health insurance companies. It was illegal. We changed that, and our whole world changed. It became profit motive over healthcare. We need to go back. So on this one issue, I might actually agree with our current president. Maybe we do need to go back and do things the way we used to do it. What do you think about that? No profit in health insurance. What a concept. I have the honor of working with physicians from all over the world. I've seen how their healthcare systems work. They're not perfect either, but they're a hell of a lot better than what we have here. So yeah, Mr. President, Australia does have a kick-ass healthcare program, and we could learn from them. And let's try to do that. So, to conclude my rant today, I'm going to encourage that every single person, Republican, Democrat, Independent, Socialist, Communist, I don't care what party you belong to, pick up the phones, call your senators, and tell them not to pass this piece of garbage legislation that the House has presented to them. And I also want you to pick up the phone and call all of your representatives who voted for it and tell them how disappointed you are and that you will not forget what they did when election time comes around. And for those who voted against it, call them and say thank you. 3-4 phone calls a person. Flood them, people. Tell them what really is happening. Tell them what our families really need. I'm a mother of a child with hypertrophic cardiomyopathy and implantable defibrillators since the age of 10. I'm fighting for a better world for her so that when she turns 27 and has to get her own policy, she can get one on her own and have health insurance that she doesn't have to worry about. And she can continue her education because she wants to go on to become a doctor herself. Who's going to cover her after 26 if she's still in school? I can't. We have to fight for our kids. We have to fight for all those with chronic illness. We have to fight for those who don't even know that there's a fight going on. because they're going to need us. Thanks so much. Hope you enjoy the blog. Bye-bye.